dark brown discharge, endometrial bleeding, ovulation, pregnancy, sexually transmitted diseases, menopause, pelvic inflammatory disease, cervical cancer, dark brown discharge. Observing dark brown discharge can cause anxiety in women. Hence, it is important to know the reasons that can cause this problem. Women who have a regular menstrual cycle know very well as to when to expect their periods. Due to this, any change in the regular pattern can cause anxiety and worry. If a woman observes brownish discharge during the time she is not expecting her periods, it can cause some tension. However, experts are of the opinion that experiencing such discharge from the vagina is not a serious condition and can be treated with some dietary as well as lifestyle changes. Nevertheless, there have been cases where it was an indication of some serious problems. Hence, it is important to know about the causes of dark brown discharge before a period as well as after it. Causes. As mentioned earlier, the occurrence of such discharge is usually not very serious. However, knowing about the different factors that can give rise to this can help in seeking immediate medical attention. With this note, let us take a look at its causes. Endometrial bleeding. Endometrium is a mucous membrane which lines the uterus and thickens so that a fertilized egg can attach itself to this lining. However, if pregnancy does not occur, this lining disintegrates and is thrown out of the body in the form of menstrual blood. These endometrial tissues have different layers and are completely shed during menstruation. However, sometimes due to some reason, certain parts of the uterine lining may not be able to shed completely. Due to this, the person may experience dark brown discharge after period or maybe before the beginning of the next periods. As the blood is a little old, it becomes dark brown in color. Ovulation. If you experience discharge between periods, it is most likely because of ovulation. In a 28-day menstrual cycle, ovulation can occur anywhere between the 14th or 16th day, counting from the first day of the periods. As the mature egg releases from the ovary, some women experience a little bleeding which is usually called spotting. Along with bleeding, one may also experience abdominal cramps during ovulation. Pregnancy. Such discharge is very common in early pregnancy and can be an indication that one has conceived. This usually occurs a few days after conception, that is, when the fertilized ovum attaches itself to the uterine wall and is called implantation bleeding. This type of discharge during pregnancy lasts for 3-4 days and is usually very light. However, if you experience dark brownish vaginal discharge anytime during your pregnancy, it is very important that you consult your doctor as soon as possible. Sexually transmitted diseases. Another reason that can give rise to the occurrence of brown discharge in women is sexually transmitted diseases. Some of the STDs that can cause this problem include gonorrhea, genital warts, chlamydia, etc. However, in this case, along with vaginal discharge, one may also experience other symptoms which include pain, burning sensation, infertility, loss of appetite, vomiting, etc. Menopause. Experiencing brown discharge instead of period is very common in women who are nearing menopause. During this time, the periods are very irregular and one may observe occasional vaginal discharge and spotting which is either pink or brown in color. Along with this, some other problems that women experience during this time include body ache, depression, foul urine odor, etc. Pelvic inflammatory disease. One of the most serious problems which can cause the dark brown vaginal discharge is pelvic inflammatory disease. This disease occurs due to the infection on the ovaries, uterus lining, fallopian tubes, cervix, and the vagina. This is commonly seen in women who have sexual contact with more than one partner. Apart from vaginal discharge, some other problems that can be caused by this disease include painful menstruation, pain during sexual intercourse, infertility, abdominal pain, etc. Cervical cancer. Cervical cancer is surely the most serious as well as the most dangerous cause of brown discharge. This type of cancer is usually caused by the virus HPV, which is spread through sexual intercourse. Some of the risk factors that can cause cervical cancer include having sex at a young age, having multiple sex partners, a weakened immune system, etc. Other than vaginal discharge, some other symptoms of cervical cancer include weight loss, pelvic pain, loss of appetite, leg pain, fatigue, etc. Although the reasons for the occurrence of brown vaginal discharge are rarely serious, if you experience any other symptoms along with it, it will be a good idea to consult your healthcare practitioner, who will try to find the root cause with the help of certain diagnostic tests. It is best to start the treatment on time to avoid aggravation of this problem.